Thank you for choosing ThoughtSwift for your practice. This about 5-minute video will give you an introductory information as well as your next steps before we implement ThoughtSwift for your practice. ThoughtSwift tablet-based assessment programs help providers increase their patient care, improve macro scores, simplify workflow, and increase practice revenue. Your first step before implementation is to review the attachments within this email. You will find 5 attachments: the ThoughtSwift Promise, Billing Guide, Frequently Asked Questions, Counseling Sheets, and Codes which need to be added to your Superbill or EMR. Our ThoughtSwift Promise explains that our first goal is to ensure that providers using our system receive the billing that they should and rightfully deserve. Simply put, it outlines that if a denial occurs and we cannot help you fix the issue, we will provide a credit on next month's bill for that assessment. It is common for practices to receive denials in the first few months due to a learning curve between these new codes and payers. Denials quickly become non-issues once billing becomes more routine. Payers get used to paying on these codes for your office, and your billing department understands how to bill each payer. To qualify for our guarantee, we require a simple commitment from your office to help us understand how your office is billing these new codes. Your commitment is to send us a weekly report that shows the billed CPT, ICD-10 codes, and modifiers selected. The reason for the report is to make sure that any obvious billing mistakes are caught early on, allowing us to ensure minimal denials. You may choose to give view-only access to your system, in which case we will pull the report for you. In either case, we will review this report and communicate to your billing department any suggestions or corrections to make your billing as accurate as possible the first time. After 90 days, or even less in many cases, this report's not required and becomes optional, but the majority of our clients prefer to have us take a look and report weekly. The Frequently Asked Questions Guide covers many of the common questions that providers ask while using our product. Please note that if you have any unanswered questions, we are available by email or phone at any time. We pride ourselves in being available to and communicate promptly with our clients. The Billing Guide provides information for billing and coding the ThoughtSwift program. Part of the implementation process will be to coach your billing department on the basics of how to bill ThoughtSwift codes. This billing guide provides general information about what codes are used and how to bill them for commercial insurance and Medicare. The counseling sheets provide links and information available to help provide counseling to your patients. This information is only a guide and should be used in conjunction with your practice's current standard of care. The last document is a list of CPT codes that must be added to your Superbill or to your EMR. Most modern EMR systems have these codes embedded already, but if not, you may have to add them. We suggest contacting your EMR service provider directly for more help on this step if needed. If at all possible, we suggest having this completed before implementation. The next thing we need to cover is the best time to administer electronic health assessments and annual wellness visits. The electronic health assessment is designed for all commercial and Medicare patients. ThoughtSwift EHA works best in conjunction with regular office appointments. If an EHA is performed on the same day as a preventative appointment, such as a well woman or yearly physical, the entire billing will be bundled and the claim will be denied. EHAs must be performed on any standard office appointment and should never be given out during a preventative visit. The annual wellness visit is only for Medicare patients. Although it can be billed in conjunction with an office visit, we suggest that it be a standard event whenever possible. We highly suggest that you perform counseling on the same day as the AWV, including obesity, alcohol misuse, and end-of-life planning. The only additional restriction of note is that an EHA and an annual wellness visit should not be performed on the same day, as doing so will result in bundling of some codes. Workflow is individual to each practice, and what works at one location may not work anywhere else. Generally, clients either hand the tablet out in the waiting room or the exam room, which are optional times to administer assessments. Either area can work depending on your staff's workflow, and the key to success is always, please be consistent. We recommend ensuring that your staff understands assessments should be a consistent part of each day. As you are planning, please keep in mind that ThoughtSwift needs a designated go-to person, or what we call the ThoughtSwift champion, in your office, who will be our key point of contact. During implementation, we will work with the ThoughtSwift champion to fit our solution to your environment. Again, our service only works if the tablets are being handed out consistently in a routine that works well within your office. Finally, ThoughtSwift is not a magic box that prints money, but it is a tool that, when used properly, will provide better patient care, help improve your macro scores, and increase your practice's revenue. No system is perfect. Issues do arise, denials do occur, problems can happen, but we're here to help. All we ask is that when you have an issue, that you let us know so that we can find the solution. Most problems can be fixed if we know about them, so please keep the conversations open and let us know how we can help. We look forward to our partnership in the success of your practice.